When we think about body fat, we often picture the visible fat on our limbs and abdomen. But not all fat is created equal. In this CP talk, we will explain the differences between subcutaneous fat and visceral fat, and why visceral fat poses a greater health risk. All obesity is not the same. You can either be TOFI, thin outside, fat inside, or FODI, fat outside, thin inside. Pause the video and look at this illustration of the difference between visceral and subcutaneous fat. Subcutaneous fat is stored just under the skin, which is what we typically see and feel. Visceral fat is stored around internal organs, which is not visible but more dangerous. Health risks. Visceral fat is linked to serious health conditions such as heart disease, type 2 diabetes, and metabolic syndrome. Visceral fat can lead to chronic inflammation, contributing to various diseases. Visceral fat releases chemicals that inhibit the functioning of insulin, leading to type 2 diabetes. TOFI, thin outside, fat inside. Definition: individuals who appear thin limbs-wise but have a high amount of visceral fat. Health implications: despite having a normal BMI, TOFI individuals are at higher risk for metabolic diseases. Detection: waist measurement. Measured with a tape measure around one's waist just above one's hip bones. Waist-to-hip ratio. Measure your waist size and your hip size. Wrap a tape measure around the widest part of your hips. One can also use a skin fold caliper to measure body fat percentage. Some bathroom scales with body composition assessment capabilities also have the ability to measure percent body fat. Magnetic resonance imaging, MRI, and computed tomography, CT, are considered the gold standard for measuring visceral fat and are highly accurate. Dual energy X-ray absorptiometry, referred to as DEXA, offers highly detailed imaging capabilities. With it, healthcare professionals can measure bone density, muscle, and total body fat, which includes visceral fat. Healthy lifestyle. Dietary and lifestyle modifications are necessary. This includes self-care strategies, as those who are highly stressed and not managing it well tend to have higher visceral fat levels as a result of cortisol release. FOTI, fat outside, thin inside. Definition: individuals who have high subcutaneous fat but low levels of visceral fat. Health implications: while they may appear overweight, FOTI individuals often have a lower risk of metabolic diseases compared to TOFI individuals. Healthy lifestyle. A balanced diet and regular exercise is necessary to maintain low visceral fat levels. Conclusion: clearly, all fat is not the same. One's BMI is just one piece of the puzzle in evaluating one's health. One can argue that one's waist-to-hip ratio or waist measurement or body fat measurement gives a clearer indication of risk of cardiovascular disease. Remember, it's not just about how we look on the outside, but what's happening inside our bodies, especially in our gut region, that truly matters. Please get regular health checkups, including blood work, and adopt a healthy diet and lifestyle to manage visceral fat. Thanks for watching. Please like, subscribe, comment, and share.